Improving smoking cessation in pregnancy for Aboriginal and Torres Strait Islander women living in a rural area through health literacy. We acknowledge and respect the traditional lands of all Aboriginal and Torres Strait Islander people. We respect all elders past, present and future. We ask that all people who walk, work and live on traditional Aboriginal lands to be respectful of culture and traditions and to work together as one to better Aboriginal health. Hello, my name is Meg Murad and I will be narrating the presentation on improving smoking cessation in pregnancy for Aboriginal and Torres Strait Islander women living in a rural area through health literacy. I would like to acknowledge the work of Ashley Frensham in preparing the links between culture and Aboriginal and Torres Strait Islander health, Alana Robson in preparing the information relating to social determinants of health and their link to health literacy, and Caitlin Webber in preparing the considerations for competent and safe midwifery practice. This presentation will look at improving smoking cessation rates in pregnancy of Aboriginal and Torres Strait Islander women. It will explain the implication of culture, connection to country, an Aboriginal and Torres Strait Islander person's perspective of health and how they engage with the health system. It will illustrate how the social determinants of health and health literacy impact on the rates of smoking for Aboriginal and Torres Strait Islander women in pregnancy and how midwives can offer care that is culturally safe and competent in addressing this issue. The case study being referred to throughout this presentation is Voices of Aboriginal Women on Barriers Accepting Smoking Cessation Support During Pregnancy. This study was undertaken in the Hunter, New England region of New South Wales. It explores the views of Aboriginal and Torres Strait Islander women on what supports would best aid and be accepted to improve smoking cessation in pregnancy. This direction has been taken as there has only been one cessation trial undertaken with Aboriginal and Torres Strait Islander women that reported a non-significant change in quit rates. As the current programs have done little to reduce the rates of smoking in pregnancy for Aboriginal and Torres Strait Islander women, it is imperative that we look to what they are saying to build programs that will meet their needs. When considering ways to help improve the health behaviours and overall health of Aboriginal and Torres Strait Islander peoples, it is imperative that we have an understanding of exactly what health means to Aboriginal and Torres Strait Islander peoples. For Aboriginal and Torres Strait Islander peoples, health encompasses the physical, social, emotional, spiritual and cultural well-being of the whole community. Each individual should have the ability to reach their full potential and ensure the good health of the whole community. Essentially, this means that if one member of the community is not in good health, then neither is the community. The Close the Gap campaign is a government initiative aimed at helping to reduce the health disparities that currently exist between Aboriginal and Torres Strait Islander peoples and non-Indigenous populations of Australia. One focus area of this campaign is to reduce the infant mortality rates in the Aboriginal population. Smoking during pregnancy is one of the health-related behaviours contributing to low birth weight and small for gestational age infants, and this directly correlates with high infant mortality rates. So how is the Aboriginal and Torres Strait Islander people's culture and feelings towards health impacting their smoking rates during pregnancy? And how, through health literacy, can we help reduce these rates and improve health outcomes for the Aboriginal and Torres Strait Islander community? When Aboriginal and Torres Strait Islander peoples speak of their culture, they refer to their land, language and traditions. To Aboriginal and Torres Strait Islander peoples, their land or country is far more than the rocks, trees and riverbeds. It represents all living things and the spirits of their ancestors who came before. It is their sole provider, and they must give back to and nourish the land for everything to remain in harmony. Being such a defining factor of who they are, it is understandable why Aboriginal and Torres Strait Islander peoples do not wish to leave their land to access health services not readily available in their local area. This is supported by the feelings of the women from the Hunter, New England area, who claim that receiving healthcare support on their land from their community's elders would be far better received and more culturally appropriate for them. So, if we don't have accessible health services such as smoking cessation programs for Aboriginal and Torres Strait Islander women in their local communities, we are ensuring a lack of health literacy, a lack of access, and continued adverse outcomes for the Aboriginal and Torres Strait Islander peoples. For many Aboriginal and Torres Strait Islander women, English is not their first or preferred language. This is important to take into consideration when trying to build health literacy in the Aboriginal and Torres Strait Islander community. The more comfortable a person is, the greater their understanding of the information being relayed, the greater the chance they will use that information going forward to improve their health behaviours and outcomes. Traditions also play a huge role in Aboriginal and Torres Strait Islander culture. It is important to acknowledge the significance of smoking ceremonies and how this may change the perception of smoking to Aboriginal and Torres Strait Islander peoples. Smoking ceremonies, which are undertaken under various circumstances, involve burning different native plants and producing smoke, which is believed to ward off bad spirits and cleanse the land. Because Aboriginal and Torres Strait Islander peoples have such an affinity with fire and smoke for cleansing and healing, it is important to ensure that the health literacy in the Aboriginal and Torres Strait Islander community clearly shows the negative impacts of cigarette smoking on the health of the community. This includes pregnant women and their unborn children, as well as any other community member that either smokes or passively smokes. It's imperative to highlight the detrimental effects that cigarette smoking can have on the whole community, and to show understanding of how their cultural beliefs impact their health behaviours, and further support pregnant women in the community to help cease smoking during pregnancy. According to the World Health Organization, health inequities arise from the societal conditions in which people are born, grow, live, work, and age, referred to as social determinants of health. It is important to understand that smoking in pregnancy is perhaps the most important modifiable risk factor, resulting in poor health outcomes for a mother and her baby, and is an independent determinant of health. However, it is other social determinants of health that lead to the uptake of smoking and present barriers to smoking cessation for Aboriginal and Torres Strait Islander women. Looking at past policy, social exclusion and education gives us a clearer understanding of the high rate of smoking in pregnancy for Aboriginal and Torres Strait Islander women. The rate of smoking in pregnancy for Aboriginal and Torres Strait Islander women is 4 times greater than that of non-Indigenous women, which is approximately 45% compared with 11%. In the Hunter New England region, the rate of smoking in pregnancy for Aboriginal and Torres Strait Islander women increased between 2008 and 2011 from 42% to 51.7%, but has since decreased to 39.7%. Where over the same period, non-Indigenous women decreased the rate of smoking in pregnancy from 15.8% to 13.9%, and this rate has decreased further to the current rate of 11.3%. Tobacco was introduced to the Aboriginal and Torres Strait Islander peoples following colonization and was included in rations on missions. It is the social consequences such as loss of land, language, culture and social systems that resulted from colonization that led to disadvantage and high levels of stress, which resulted in widespread tobacco use amongst Aboriginal and Torres Strait Islander peoples. Social exclusion also plays a part in the smoking rates of Aboriginal and Torres Strait Islander women. Social exclusion is created through discrimination, unemployment, stigmatization, and racism, and increases the risk of addiction. The national unemployment rate for Aboriginal and Torres Strait Islander peoples in 2014 and 2015 was over half at 54%, with women being twice as likely to be unemployed than men. These statistics clearly emphasize the disadvantage and exclusion experienced by Aboriginal and Torres Strait Islander peoples, presenting barriers to smoking cessation in pregnancy. Social exclusion should also be understood in the context of community. Smoking and sharing tobacco is normalized within the Aboriginal and Torres Strait Islander community. It is part of family and friendships, and those not smoking may feel excluded or isolated. High unemployment rates are linked with low education levels, which are considered a key area for closing the gap in relation to maternal and infant health outcomes. A lower level of education impedes the development of health literacy, preventing individuals from becoming empowered. An important element in addressing smoking cessation in pregnancy is health literacy. To be health literate, an individual must possess the ability to make sound health decisions in everyday life. Health literacy promotes individuals to engage in their care, to feel empowered, and to participate in preventative health measures rather than risk taking behaviours such as smoking. By providing health education on the benefits of smoking cessation and the risks of smoking when pregnant, we are facilitating empowerment, ensuring women are making informed decisions, and aiding women in accessing appropriate and relevant information, and using that information to build health literacy. Unfortunately, research has indicated that midwives working with Aboriginal and Torres Strait Islander women are hesitant on offering education on smoking cessation in pregnancy, in the fear that it may turn them away from antenatal care. This contradicts the voices of Aboriginal and Torres Strait Islander women who rated midwifery support the second most beneficial support and encouraged them to quit smoking in pregnancy. Midwives need to educate women on the health benefits of smoking cessation for both a woman and her infant. Aboriginal and Torres Strait Islander women interviewed felt they were more often told to cut down the number of cigarettes that they had in a day rather than being supported to quit altogether. It is essential that women understand that even one cigarette a day can be detrimental for health outcomes. Facts and figures. Tobacco was introduced into the Aboriginal and Torres Strait Islander community through colonisation. 4 times more Aboriginal and Torres Strait Islander women smoke in pregnancy compared with non-Indigenous women, 45% versus 11%. Infants born to Aboriginal and Torres Strait Islander women are more likely to be premature, 13.9% versus 7.9%, and have low birth weight, 12% versus 6.2%, in comparison to non-Indigenous women. For the Hunter, New England area, the rate of low birth weight infants born to Aboriginal and Torres Strait Islander women is currently 10.8%. Low birth weight and premature births are linked to smoking in pregnancy. The health outcomes for those living in rural areas are worse than those living in urban areas, and this is significant as 43% of Aboriginal and Torres Strait Islander peoples live in rural areas. Approximately 65,000 Aboriginal and Torres Strait Islander people call the Hunter, New England region home, making up 5.4% of the region's population. This is larger than the national average, which is 3.8%. 2 key components for the Close the Gap campaign are education attainment, with low levels for Aboriginal and Torres Strait Islander peoples at 25.7% in 2014 and 2015, and high unemployment rates at 54%. So in knowing all this, how do we as midwives provide care that is considered safe and competent for Aboriginal and Torres Strait Islander women? Aboriginal and Torres Strait Islander women have continuously faced a significant disparity in maternal health care outcomes. It is vital to take this into consideration when practicing midwifery in order to provide culturally safe care for Aboriginal and Torres Strait Islander women to ensure effective care and ultimately improve healthcare outcomes. Historically, Aboriginal and Torres Strait Islander people have experienced a lack of cultural understanding and culturally safe care within healthcare services in Australia. This continues to present day and is a major source for the mistrust between Aboriginal and Torres Strait Islander people and the healthcare system. Systems and programs that provide culturally safe and appropriate health care are known to improve the experiences for Aboriginal and Torres Strait Islander women accessing these health services and can contribute to the increased positive health outcomes. As midwives, it is important that we understand and appreciate the significance of the care that we aim to provide and the impact we can have on Aboriginal and Torres Strait Islander women. The Congress of Aboriginal and Torres Strait Islander Nurses have outlined the essential features of cultural safety as an understanding of one's own culture, an acknowledgement of difference, and a requirement that caregivers are actively mindful and respectful of differences, is informed by the theory of power relations, is the experience of recipient of care and is not defined by the caregiver. To provide culturally safe care, midwives and all healthcare professionals must be aware of each of these elements to be successful in providing care that meets the needs of Aboriginal and Torres Strait Islander women during pregnancy. One of the competency standards included in the National Competency Standards for the Midwife stresses the importance of midwives providing culturally safe care, which includes all the elements mentioned before. A A successful service run in the Hunter New England area is the Be Release service for pregnant Aboriginal and Torres Strait Islander women, babies, children, and non-Aboriginal women who are pregnant with a baby they will identify as Aboriginal or Torres Strait Islander. This service provides culturally appropriate support and education during pregnancy and the postnatal period. This program gives access to Aboriginal health education officers, registered midwives, child and family health nurses, social workers, and lactation consultants. These services are available to Aboriginal and Torres Strait Islander women in their home, which has been known to be effective in removing the barrier to access to health services. However, to be able to attend this service, women must be referred to the service by either their doctor, the antenatal clinic at their booking in appointment, or the Awakabal Medical Service. Some women may still see this as a barrier to accessing the service. These kinds of services are greatly needed in all areas of Australia, with approximately 32% of Indigenous Australians living in major cities, 43% in regional areas, and 25% in remote areas. One study looked at women's experiences of a maternity service for Australian Aboriginal and Torres Strait Islander families and concluded that when a service provides all elements of culturally safe care when working with Aboriginal and Torres Strait Islander women and their communities, improved health outcomes were clearly evident. The study also discussed how the cessation of smoking in pregnancy was a particularly challenging issue for Aboriginal and Torres Strait Islander families, where even pregnancy was not a priority for most women in comparison to social and economic pressures that they faced. This study was conducted in an urban area in Sydney. However, due to the lack of research in rural areas, its information and results can still be beneficial when gathering data related to Aboriginal health outcomes. It was concluded that the Aboriginal and Torres Strait Islander specific service saw some decrease in smoking rates in the women who attended their service. The study then suggested that more research and evidence was needed to provide direct links between the service and smoking rates. When the healthcare system provides all elements of culturally safe care, removes barriers to accessing healthcare, and provides a system that Aboriginal and Torres Strait Islander women can trust, there is a significant improvement in health outcomes for mothers and their babies. Although more research is needed towards improving the smoking cessation rates of Aboriginal and Torres Strait Islander women from regional areas, we can undoubtedly see from the current research that there are steps we can take to start making positive changes now. Midwives are uniquely positioned to improve the smoking cessation rates in pregnancy for Aboriginal and Torres Strait Islander women and ultimately the health outcomes of individuals and communities. Once we understand an individual's capacity to learn and tailor the sharing of information and education to suit, we help a woman to develop knowledge and capacity, thereby improving their level of health literacy, leading to changed behaviours and improved outcomes. As midwives, part of our practice in the real world is to ensure the care we are providing to Aboriginal and Torres Strait Islander women is safe and successful. We do this by acknowledging our own culture and being aware of differences and being aware of power-laden relationships and the bearing that has on how a woman feels about her caregiver. We must remember that building good rapport with our women is of the utmost importance in order to effectively communicate and develop trust and provide a welcoming environment. Midwives should sit next to women, remembering they are working with them, not doing to them. It is crucial that we as midwives are also inclusive of family and respect their involvement in a woman's care. We should provide education that is culturally appropriate to effectively aid the women to build health literacy, so they are then able to make informed decisions regarding their health. Midwives must work within a woman's social settings and address her emotional and spiritual well-being as part of their overall health. Midwives should commit to lifelong learning about Aboriginal and Torres Strait Islander safety to ensure they are respectful of a woman's cultural and health beliefs when they are in their care. Midwives must also be mindful and respectful that a woman has the right to refuse care. Providing continuity of care within a woman's community where possible and being flexible in the delivery of services and appointment times can have significant positive outcomes, as well as collaborating with other services and communities to ensure a woman is receiving the individual care that suits her needs. Aboriginal and Torres Strait Islander people's connection to country presents a barrier to accessing health services not readily available in their local community. This is of greater concern in a rural area where health services are already limited in comparison to urban areas. In addition, the accessibility of health services, past policy, social exclusion and education bear significance to the rates of smoking in pregnancy for Aboriginal and Torres Strait Islander women. Improving health literacy for Aboriginal and Torres Strait Islander women through health promotion and education is vital to encourage women to engage in their own care, to feel empowered, and to participate in preventative health measures, rather than risk-taking behaviours such as smoking. Improved health literacy leads to a change in health behaviours, improving the outcomes of women and their infants, and in turn the community as a whole. Aboriginal and Torres Strait Islander women feel that support from a midwife would be beneficial in aiding them to cease smoking in pregnancy. For midwifery care to be successful in working with Aboriginal and Torres Strait Islander women, we must provide care that is culturally safe and competent. In conclusion, midwives and other healthcare providers must have some understanding of local Aboriginal and Torres Strait Islander culture and traditions, and must find ways to cater to the cultural needs of the woman, her family, and her community, if they hope to provide competent and culturally safe healthcare. Only with that can we work to successfully improve smoking cessation rates in pregnant Aboriginal and Torres Strait Islander women living in rural areas, and subsequently improve the overall health outcomes for the whole community.